If you keep missing GI questions on the Nclex, this is exactly why. Today, we're breaking down 50 GI Nclex questions most students get wrong, and not basic surface-level questions. I'm talking about the tricky, exam trap, priority-style GI questions that destroy scores. We're covering GI bleeding prioritization, pancreatitis management, liver failure complications, bowel obstruction traps, NG tube and TPN confusion, and those SATA questions that look easy but aren't. If you want to pass Nclex on your first attempt, you must master high-risk GI concepts. This is MCQs Master 101, where we train like the exam is tomorrow. Let's get straight into it. Question 1. Which part of the gastrointestinal tract is most commonly affected in Crohn's disease? A. Rectum only. B. Colon only. C. Terminal ileum. D. Stomach only. Correct answer is C. Terminal ileum. Crohn's disease most commonly affects the terminal ileum, but can involve any part of the GI tract. Question 2. Ulcerative colitis characteristically affects which layer of the bowel wall? A. Serosa. B. Muscularis. C. Submucosa. D. Mucosa. Correct answer is D. Mucosa. Ulcerative colitis causes inflammation limited to the mucosal layer. Question 3. Which pattern of bowel involvement is typical of Crohn's disease? A. Continuous lesions. B. Skip lesions. C. Rectal sparing never occurs. D. Only left-sided disease. Correct answer is B. Skip lesions. Crohn's disease shows patchy, discontinuous areas of inflammation. Question 4. Which symptom is more common in ulcerative colitis than Crohn's disease? A. Fistula formation. B. Bloody diarrhea. C. Malabsorption. D. Weight loss. Correct answer is B. Bloody diarrhea. Ulcerative colitis commonly presents with bloody stools. Question 5. Transmural inflammation is a feature of which condition? A. Ulcerative colitis. B. Irritable bowel syndrome. C. Crohn's disease. D. Celiac disease. Correct answer is C. Crohn's disease. Crohn's disease affects the entire thickness of the bowel wall. Question 6. Which complication is more associated with Crohn's disease? A. Toxic megacolon. B. Colon cancer. C. Fistulas. D. Rectal bleeding. Correct answer is C. Fistulas. Transmural inflammation in Crohn's disease leads to fistula formation. Question 7. Ulcerative colitis usually begins in which area? A. Ileum. B. Ascending colon. C. Rectum. D. Jejunum. Correct answer is C. Rectum. Ulcerative colitis always involves the rectum initially. Question 8. Which extraintestinal manifestation is common in both Crohn's disease and ulcerative colitis? A. Renal failure. B. Arthritis. C. Myocarditis. D. Stroke. Correct answer is B. Arthritis. Both conditions may present with joint inflammation. Question 9. Which diagnostic test is most useful for confirming inflammatory bowel disease? A. Abdominal ultrasound. B. Colonoscopy with biopsy. C. Stool culture. D. Barium swallow. Correct answer is B. Colonoscopy with biopsy. Colonoscopy allows direct visualization and histologic confirmation. Question 10. Which finding is characteristic of Crohn's disease on colonoscopy? A. Pseudopolyps. B. Continuous ulceration. C. Cobblestone appearance. D. Loss of haustra. Correct answer is C. Cobblestone appearance.
Question 11. Loss of haustration, lead pipe colon, is associated with A. Crohn's disease. B. Ulcerative colitis. C. IBS. D. Diverticulitis. Correct answer is B. Ulcerative colitis. Chronic inflammation causes smooth, rigid colon walls. Question 12. Which medication is commonly used to maintain remission in ulcerative colitis? A. Loperamide. B. Mesalamine. C. Metoclopramide. D. Omeprazole. Correct answer is B. Mesalamine. 5-ASA drugs help reduce mucosal inflammation. Question 13. Which nutrient deficiency is common in Crohn's disease involving the ileum? A. Iron. B. Vitamin B12. C. Calcium. D. Vitamin C. Correct answer is B. Vitamin B12. Vitamin B12 is absorbed in the terminal ileum. Question 14. Which condition has a higher risk of colorectal cancer with long disease duration? A. Crohn's disease. B. Ulcerative colitis. C. IBS. D. Appendicitis. Correct answer is B. Ulcerative colitis. Long-standing UC significantly increases colon cancer risk. Question 15. Which stool characteristic is typical in ulcerative colitis? A. Fatty stools. B. Bloody mucus stools. C. Clay-colored stools. D. Watery stools without blood. Correct answer is B. Bloody mucus stools. Mucosal ulceration leads to blood and mucus in stool. Question 16. Which imaging finding supports Crohn's disease? A. Apple core lesion. B. String sign. C. Pneumoperitoneum. D. Gasless abdomen. Correct answer is B. String sign. Narrowed segments of bowel create the string sign. Question 17. Smoking has what effect on Crohn's disease? A. Improves symptoms. B. No effect. C. Worsens disease. D. Prevents relapse. Correct answer is C. Worsens disease. Smoking exacerbates Crohn's disease. Question 18. Smoking has what effect on ulcerative colitis? A. Worsens disease. B. No effect. C. Protective effect. D. Causes remission failure. Correct answer is C. Protective effect. Smoking appears to reduce UC severity, though not recommended. Question 20. Which complication is life-threatening in ulcerative colitis? A. Fistula. B. Toxic megacolon. C. Malabsorption. D. Perianal abscess. Correct answer is B. Toxic megacolon. Severe inflammation causes colonic dilation and perforation risk. Question 21. Which surgery is curative for ulcerative colitis? A. Ileal resection. B. Partial colectomy. C. Total colectomy. D. Fistula repair. Correct answer is C. Total colectomy. Removing the colon eliminates ulcerative colitis. Question 21. Surgery in Crohn's disease is usually A. Curative. B. Avoided entirely. C. For complications only. D. Done early. Correct answer C. For complications only. Crohn's disease often recurs after surgery. Question 22. Which perianal condition is common in Crohn's disease? A. Hemorrhoids. B. Anal fissures. C. Perianal fistulas. D. Rectal prolapse. Correct answer C. Perianal fistulas. Question 23. Which laboratory finding suggests active IBB? A. Low ESR. B. Elevated CRP. C. High calcium. D. Low glucose. Correct answer, B. Elevated CRP. Question 24. Which immune mechanism is involved in IBD? A. IgE-mediated allergy. B. Autoimmune inflammation. C. Bacterial toxin release. D. Viral destruction. Correct answer, B. Autoimmune inflammation. Question 25. Which biologic therapy is used in moderate to severe IBD? A. Insulin. B. Infliximab. C. Warfarin. D. Digoxin. Correct answer, B. Infliximab. Question 26. Rectal sparing is more typical of A. Ulcerative colitis. B. Crohn's disease. C. IBS. D. Colon cancer. Correct answer, B. Crohn's disease. Question 27. Which age group commonly presents with IBD? A. Infants. B. Adolescents and young adults. C. Middle-aged only. D. Elderly only. Correct answer, B. Adolescents and young adults. Question 28. Which complication results from chronic inflammation and fibrosis in Crohn's disease? A. Strictures. B. Polyps. C. Hemorrhage. D. Diverticula. Correct answer, A. Strictures. Question 29. Which electrolyte imbalance may occur due to chronic diarrhea? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypermagnesemia. Correct answer, B. Hypokalemia. Question 30. Which symptom suggests severe ulcerative colitis? A. Constipation. B. Tenesmus. C. Mild abdominal pain. D. Occasional diarrhea. Correct answer, B. Tenesmus. Question 31. Which bowel sound may be heard during active IBD? A. Absent sounds. B. Hypoactive sounds. C. Hyperactive sounds. D. No change. Correct answer, C. Hyperactive sounds. Question 32. Which stool test helps distinguish IBD from IBS? A. Occult blood. B. Fecal calprotectin. C. Stool pH. D. Stool glucose. Correct answer, B. Fecal calprotectin. Question 33. Which vitamin deficiency causes anemia in IBD? A. Vitamin A. B. Vitamin B12. C. Vitamin D. D. Vitamin E. Correct answer, B. Vitamin B12. Question 34. Which symptom is more common in Crohn's disease than ulcerative colitis? A. Rectal bleeding. B. Crampy abdominal pain. C. Tenesmus. D. Mucus stools. Correct answer, B. Crampy abdominal pain. Question 35. Which structure is typically not affected in ulcerative colitis? A. Rectum. B. Sigmoid colon. C. Transverse colon. D. Small intestine. Correct answer, D. Small intestine. Question 36. Which finding suggests dehydration in IBD patients? A. Bradycardia. B. Hypotension. C. Hypertension. D. Weight gain. Correct answer, B. Hypotension. Question 37. Which nursing priority is most important during severe IBD flare? A. Pain control. B. Nutritional support. C. Fluid and electrolyte balance. D. Emotional support. Correct answer, C. Fluid and electrolyte balance. Question 38. Which dietary modification is helpful during acute flare-ups? A. High-fiber diet. B. Low-residue diet. C. High-fat diet. D. Spicy foods. Correct answer, B. Low-residue diet. Question 39. Which colon finding is typical in ulcerative colitis? A. Deep fissures. B. Patchy ulcers. C. Pseudopolyps. D. Cobblestoning. Correct answer, C. Pseudopolyps. Question 40. Which condition may coexist with IBD? A. Diabetes mellitus. B. Primary sclerosing cholangitis. C. Peptic ulcer disease. D. GERD. Correct answer, B. Primary sclerosing cholangitis. Question 41. Which sign indicates worsening disease? A. Weight gain. B. Decreased stool frequency. C. Fever. D. Improved appetite. Correct answer, C. Fever. Question 42. Which lab value indicates chronic blood loss? A. Elevated hemoglobin. B. Low hemoglobin. C. Elevated sodium. D. High potassium. Correct answer, B. Low hemoglobin. Question 43. Which complication is common in long-standing Crohn's disease? A. Bowel obstruction. B. Appendicitis. C. Hemorrhoids. D. Hernia. Correct answer, A. Bowel obstruction. Question 44. Which symptom differentiates IBS from IBD? A. Abdominal pain. B. Diarrhea. C. Inflammation on biopsy. D. Bloating. Correct answer, C. Inflammation on biopsy. Question 46. Which medication suppresses immune response in IBD? A. Azathioprine. B. Acetaminophen. C. Ondansetron. D. Docusate. Correct answer, A. Azathioprine. Question 47. Which stool frequency suggests severe ulcerative colitis? A. 1 to 2 stools per day. B. 3 stools per day. C. Greater than 6 bloody stools per day. D. Constipation. Correct answer, C. Greater than 6 bloody stools per day. Question 48. Which complication is least likely in ulcerative colitis? A. Colon cancer. B. Toxic megacolon. C. Fistula. D. Severe bleeding. Correct answer, C. Fistula. Question 49. Which assessment finding indicates malnutrition? A. Edema. B. Weight loss. C. Hypertension. D. Bradycardia. Correct answer, B. Weight loss. Question 50. Which statement best differentiates Crohn's disease from ulcerative colitis? A. Crohn's disease is limited to the colon. B. Ulcerative colitis affects the full bowel wall. C. Crohn's disease can affect any GI tract part. D. Ulcerative colitis causes skip lesions. Correct answer, C. Crohn's disease can affect any GI tract part.
If you made it through all 50 questions, you're already ahead of most candidates. Remember, Nclex is not about memorization. It's about clinical judgment, prioritization, and recognizing life-threatening GI complications early. If this video challenged you, good. That means you're training at the right level. Make sure you like this video, subscribe to MCQs Master 101, turn on notifications, and comment your score below. Next, go watch our other high-level Nclex question breakdowns and keep building exam day confidence. Train hard, think critical, pass Nclex. See you in the next session.